Hey everybody, Pinnacle Physical Therapy back with you guys. Today we're here with Steven. Steven had a quad repair and a fat pad removal on his left knee from a work injury. He's doing great. We're starting to advance his things to work on him being able to lower himself downstairs. It's called an eccentric lowering activity. It's a closed chain activity that puts a lot of load into the quad. And an easy way to start doing that is, we have a 2-inch block, but using a 2x4 or something about that height, he's going to step all the way up onto it. He's going to bring his butt back towards me a little bit, and he is going to bend his knee and then right back up. Good. Right back up. Good. And you can see how hard he's working right now. He's shaking, his muscles are working really hard. And he's lowering down, and just that little bit is what is going to help you as you go to lower yourself down a stair. That's a really, really good, strong quad activation activity. His brain's doing a good job trying to connect with it, and that's going to be a real beneficial activity for lowering yourself down a stair. All right, Steven is pretty advanced in his progression overall. We're starting to bring in the proprioceptive challenges, balance training, challenging all the muscles in his legs to keep him stable. He's on a very unstable surface right now. Not sure if you can see it, but he's working just standing on here. But adding in a ball bounce forces your vision to follow what the ball is doing and not be looking down at what your feet are doing. It speeds up your reaction time, and it creates a better platform for his quad, for his core, to really stay strong and engaged. So he's going to do a couple throws to show you guys, and if you can see, you'll see him start shaking a bit. Perfect. Another really good exercise is single leg stance. He's going to use the ball against the rebounder and do a couple tosses while maintaining a single leg stance. If you don't have something like that, you can use a tennis ball and toss it with someone back and forth. Again, challenging your proprioceptive ability, like that. And if you don't have somebody to throw it with, you just throw it against a wall and bounce it back, but it's a really, really good exercise. Good. All right, so in a conclusion for what I went through with Steven, he's probably about 75% through his progression for the plan of care. If we were starting earlier and you were seeing some of his earlier exercises, it would be a lot more initiation of quad and hamstring control. We are still doing some inflammation control with him. He does swell after doing excessive exercises and things like that. So he does get modality things. But as you can see in his exercises, they're pretty advanced. He's doing a lot of balance training to proprioceptively stimulate a lot of ankle stability, hip stability. Those are kind of like your foundation for the knee, okay? So when I kind of explain the knee, if the knee is your house, your ankle is your foundation, your hip is your roof. If your foundation's crumbling or your roof has a leak, your knee's not ever going to be good. So we do a lot of things to address the things around the knee and not just specifically the knee joint itself, because you need those balance of good stability in the above and below the knee itself. He's doing great. And he was doing some really advanced things, standing on a BOSU and creating a balance challenge along with quad activation and neuromuscular control of the quads and hamstrings. So just to give you a little insight about where he's at in the process, he's pretty advanced. So if you guys got questions, we're here, we're working, and if you're have an injury, an orthopedic issue, the guidelines are trying to keep you out of the ER and hospitals and things like that. Physical therapy is a great spot to have some orthopedic issues checked out. Most of the time, if you just call your doctor and say, hey, I twisted my ankle, but I don't want to go to the hospital, can I go talk to my therapist or a physical therapist? Give Pinnacle Physical Therapy a call and we can help you out with all those issues. So, all right, stay safe, everybody. Thanks.